met you yet, but hi. My friend Anna goes to the TMJ therapy.
Oh, fantastic.
And
Awesome.
we met today and we were talking about it. She's like, wait, scroll back up. And I scrolled and she was like, oh, I know Casey. She's like, that's who I'm here with my TMJ. She goes, and it's funny because she said, if you need a functional doctor, I got someone. I said, hi.
Hey, look at us.
See?
I know.
I love that.
That's
awesome. Hey, come on in. Thanks, Ian. All right. Hi, everyone. The mic is going to work tonight and it's going to be recording because, last time it did not, but it will. Excited to have Dr. Casey Jones. I'm going to really briefly, she's heard this story like 500 times, but about 2 or 3 years ago, I'd had mold. My nervous system was wrecked. I moved into a house that had electric hot wire in my bedroom. So I literally felt like I was buzzing. It was crazy, crazy times. And I was like, man, I'm doing all this nervous system stuff. It's kind of helping, but I still feel so, revved up, and was like, I don't know what to do. Met Dr. Jones. She had a breathing webinar, and I'm not even kidding, like 45 minutes of her teaching me how to actually breathe. I was like, oh, I'm back. There I am. There's my nervous system. So I was like, totally, recommend her. She's awesome. We're in like a wellness collaboration that she leads, which is awesome. So we get to, refer back and forth to each other. And it's just been fun to go alongside her and meet everyone. And she's amazing. And you guys are going to love her. So I'm going to hand over the mic that's working.
Thank you so much. I'm excited to be here, and you are amazing. So it's been such a pleasure to get to know you, and very grateful to have you for patients. So thank you for having me. We're going to talk about your breath at the heart of it all. So I'm a dentist, and I've been a dentist for coming up on 14 years now. And I've always believed that oral health was part of your overall health. And now I believe that breath is at the heart of it all. And so today we're going to talk about how breathing affects oral health, overall health, mental wellness, sleep quality, and so much more. So you can go ahead and scroll. Who am I? So I'm Dr. Casey Jones. I was a former professional dancer. I met my husband on a national tour of My Fair Lady. And we got to perform on cruise ships together for a while before dental school and all of that. We have 2 adorable kids, Noah and Lily. They are soon to be 11 and 13. They're getting so grown up. And we were just talking about, I trained with Patrick McEwen on breath retraining, both in the Oxygen Advantage and Buteyko Clinic methods, because I was jogging one day and I came home. I was actually reading the Oxygen Advantage at the time. I had been giving out close your mouth to patients for a long time because I was seeing so much more decay in people who were mouth breathing, who had asthma, who were breathing dysfunctionally. And so I, during the pandemic, read the Oxygen Advantage. And as I came home from my jog, I wrote in my journal, I want to teach the world to breathe. And I was like, that makes no sense because I'm a dentist. And then I got to the end of the book and realized that he teaches people to teach people how to breathe. So I trained with him on virtually, and then got to actually meet him, which was amazing. Got to introduce him when he was in Arizona once. And I've trained with the American Academy of Dental Sleep Medicine because breathing affects our sleep so much that I see lots of people who have obstructive sleep apnea, or at least sleep disordered breathing. And I think that dysfunctional breathing is the precursor to both of those. And I was a dysfunctional breather my whole life. I had asthma, I had allergies, I had grand mal seizures as an infant, actually. And sleep apnea runs in my family. So my mom has it, my grandma has it, my grandpa had it. That's why I got interested and did research back in college before I knew I wanted to be a dentist. So this has been something that's interested me for quite a while. So go ahead. Why does breathing matter? I love books. So this is one I love. This is another dentist, The Dental Diet, but he talks about how the body needs oxygen more than any other nutrient. And if you go to the next one, that's because we breathe 20,000 times a day. So you can go days without water, weeks without eating, but you can only go minutes without breathing. So if it's that important, we should probably be paying attention to it. But thankfully, it's in the background, because can you imagine if you had to pay attention to those 20,000 breaths that you take each day? So go ahead and go to the next one. It's automatic, but you can control it. And how you breathe affects your oral health, your overall health, and your mental health. So I just want you to take a minute and notice. You don't have to do anything about how you're breathing, but I just want you to take a minute to notice. Are you breathing through your mouth or are you breathing through your nose? Are you breathing up in your chest? Are you breathing more down in your belly? Is your breathing fast or is it slow? And now I just want you to take a minute to notice the slightly colder air as it enters your nose and the slightly warmer air as it leaves your nose. And so just take a second to notice that the air is slightly colder as it enters your nose and slightly warmer as it leaves your nose. And then you can even take one finger and place it under your nose and just start to notice that air. So as you breathe out, you're going to notice that the air is a little bit moist, a little bit warmer. You can feel that on your finger. So now see if you can just imagine that you want to breathe maybe like 5% less. See if you can feel a little less air coming out onto that finger. And gently breathe like that. And just see if as you do that, notice how it's not quite as warm, quite as moist. And so you're breathing a little bit more lightly. Okay, so go ahead and go to the next one. So I want to ask you a few questions. Do you suffer from anxiety or depression? Do you have a racing mind? Do you sigh or yawn frequently? Do you have digestive issues? Do you have acid reflux or GERD? Do you have trouble breathing through your nose? Do you snore? Do you wake up with a dry mouth? Do you toss and turn or wake up several times a night? Do you wake up to go to the bathroom several times in a night? Do you wake up feeling unrefreshed? Do you have trouble falling asleep or staying asleep? Do you clench or grind your teeth? Or do you catch yourself holding your breath? Because if you said yes to any of these, you may have dysfunctional breathing.
If you said yes to almost all of them.
Then you probably have dysfunctional breathing, and I did. So go to the next one. So then let's find out, okay? So if you have your cell phone handy and you want to grab it, you can go to the stopwatch part of things and or I can count for you, but we're going to do what's called the BOLT score or your body oxygen level test. And so essentially you are going to take a normal breath in and a normal breath out. After you exhale, you will pinch your nose or just hold your breath. I trust you. You don't have to pinch your nose. And then when you feel that first definite desire to breathe, so this is not how long you can hold your breath. This is not a contest to see the longest that you can hold it. It's the first flicker in your throat, contraction of your diaphragm, or your brain just goes, I should take a breath. And then you let go and take a normal breath in. So every time I ask people to breathe, they want me to know that they're breathing. So they're like, so I don't want you to do that. Just normal breath in, normal breath out. I shouldn't even know that you're doing it. And the weird thing is I'm asking you to hold your breath after the exhale. So just a normal exhale. So you can do it on your own time if you want, but I'll pull up my stopwatch and I'll talk you through it. And I'll just count and just listen for the number when you are going to take a breath. So you're going to take a normal breath in, normal breath out, and hold it for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm assuming that most people are done by now. Some can hold it longer. And if you did, excellent, excellent. But let's go to the next slide and I'll explain what it means. So go one more. Okay, so if you are more than 25 seconds, you are probably breathing functionally, and that is fantastic. If you are less than 25 seconds, most likely you are breathing dysfunctionally in some way. And I started at 12. So it took me a while to get above 25, but once I did, I was sleeping better, feeling better. And so it is something where you can retrain your breathing. All right, next one. So what is dysfunctional breathing? It is mouth breathing. It's chest breathing. It's rapid breathing. It's frequent sighing. It's frequent yawning. It's essentially over breathing or chronically hyperventilating. So I'm not saying that people are going all throughout the day, but if we're breathing up in our chest, all of our gas exchange occurs down here in the bottom of our lungs. So we're moving a ton of air and not actually getting the benefit of what we're breathing. If you are breathing rapidly, again, you're moving a lot of air, you're going really quickly, and you're not allowing time for that gas exchange to occur. If you're breathing through your mouth, most likely you are most likely breathing up in your chest. So try this. Take a big breath, or take a deep breath, I should say, in whatever way you would normally take a deep breath. Okay, good. Now take a big breath and do it through your mouth, and put one hand on your chest and one hand on your belly, and notice what happens. So big breath through your mouth. Okay, so most likely what you felt is that your top hand rose, okay? So as we breathe through our mouth, if we're breathing up in our chest, that's how we usually breathe when we're anxious. So it's mimicking anxiety. But if you think of taking a deep breath, and so you close your mouth, breathe through your nose, and try to have that lower hand move, oftentimes that'll feel a little bit more relaxing. Now, I know it's weird that there's frequent sighing and frequent yawning, but what happens is that our body is often trying to trick us into over breathing. So we get plenty of oxygen, but our chemoreceptors can change and be more sensitive. And so our body's like, nope, I need more to breathe. And so you'll take a big yawn or a sigh, and that's some of the ways that it can trick you. All right, go on to the next one, please. So what's functional breathing? It is breathing through your nose. It's light, it's slow, and it's low. We'll go through all of those, but this is just a resource if anybody wants it. On my website, I have a patient resource page, and it talks about all the books that I love, why I love them, products I love, so you can always check that out. But these are both definitely on there. All right, go to the next one. So the nose, it is so cool. Your nose warms, it humidifies, it disinfects the air. And if we breathe through our nose, we actually get to use nitric oxide. We naturally produce nitric oxide in our sinuses. And if we're breathing through our nose, we get the benefits of it disinfecting the air. It's actually been shown to fight the virus that causes flu and COVID. It can kill that. It's almost like a wipey for your air because our air is filthy. And it helps to open up the airway. So the mouth is a big hole that air can go through, but it was not designed to breathe the air. And the only thing that your mouth has to filter the air are the tonsils. And if you're breathing through your mouth, the tonsils tend to get big, and then they make it even harder for people to breathe because they're working overtime. Go ahead to the next one. So try this. Take your tongue and stick your tongue up. Here, I got a model. There's a little bump behind your teeth, and you can stick your tip of your tongue right there, and then just try to breathe through your mouth. Should be pretty easy to do. But go to the next one. If you take your tongue and put it on that same bump right behind your teeth, and then try to suction it up like you're gonna click it, and you'll see like this line and 2K. Like you're gonna click it, but don't click it. And then hold it up there, and then try to breathe through your mouth. If you truly have it suctioned up, you shouldn't be able to, because having the correct tongue posture actually promotes nasal breathing. Okay, go to the next one. So then the question becomes, can you breathe through your nose? Because sometimes people are just like, yeah, I breathe through my mouth and my nose. I'm like, okay, well, why? And they're like, I don't know, that's just what I need to do. But if it's a habit, we can correct that. If it's obstructed, then there may need to be some sort of surgery or some sort of procedure, whatever's going on, to correct it. But just because we correct the structure doesn't magically mean that people didn't know how to breathe. So go to the next one. I think it says try this. Yep. So I want you to try to just check. See if your nose is at all stuffy today. Okay. And if it is, just take note. And then you're going to do the same sort of thing that we did when we were doing the Bolt score, but you're going to take a normal breath in, normal breath out. You will pinch your nose, and then you're going to gently nod your head up and down as many times as you can, holding your breath until you feel like you have to take a breath. So this time it's as long as you can. And then when you have to, let go, and breathe in through your nose, and then check it again. Okay, are you ready? You're going to take a normal breath in, normal breath out. Pinch your nose. And then check it again. You can? So that's a natural nose clearing exercise. So if there's inflammation in the nose, you're actually pooling all that nitric oxide. And then when you take the next inhale, it can open up your airway and help you able to breathe. Yeah. So it's pretty cool. You can do it. So if it works for you, you can actually do it, then rest like a minute, do it 5 or 6 times, especially right before bed, and it might help with sleep. So functional breathing. Okay. So light breathing means that just like anything we're breathing more than we need to, just like we're overeating, we're over drinking, all that stuff. So if we breathe less air, this isn't all the time, but you can actually practice it, and there's several ways. So you already did one of them. When you put your finger under your nose and you were breathing maybe 5% less air, that is like breathing light and feather breathing. So you're kind of pretending that that finger is like a feather, and you're breathing so lightly that the plumes of the feather wouldn't even move. But there's other ways to do it. So one that's super, super simple is you can take your finger and plug one nostril, and they do different things, but I don't care which nostril you plug. Okay. So then you're just going to try to continue to breathe as you were before. So just notice how you feel when you do this, because you've basically cut in half the amount of air that you can breathe in, because instead of having 2 nostrils, you have 1. So just give yourself a few seconds to kind of notice what this does for you. And then you can try to take your hands too. So there's that method, but you can also take your fingers almost like a paper bag. So your fingers have holes, which is even better than a paper bag. But if you put your hands over your nose and your mouth, and then you breathe gently that way. It's almost like using a paper bag that we would give someone when they're hyperventilating. So taking in a little less air in this way, and you're going to notice how the air is warm in your hands. But this is another way that you can practice. And if at any point, these are all invitations. If at any point anything makes you feel anxious, sometimes breathing light, for people who have perfectionist tendencies, it can bring up some anxiety. So we're always just trying to like touch a little bit of a discomfort and then come back. So if breathing lightly makes you feel like, now I need more air, then just take a pause and try it again. Okay. And I did notice that I had put on there, you don't have to go back, but silent. So many people, you can hear their breathing, but we shouldn't be able to hear the breathing if you're breathing lightly. Okay, I said I love books, and this is another one that I love. So James Nestor, I actually even got to meet him, but this is one of my favorites to recommend for patients. He was pretty funny too, because I dance all the time. So I'm like, will you dance with me? And he's like, no. I was like, will you box? And he's like, yeah, I'll do that. So anyway, he was pretty cute. Okay, so slow. If you think about air coming in quickly, if you have a straw and you're breathing in through the straw and something is likely to collapse, if you breathe quickly, it's going to close in on you. But if you're breathing more lightly and there's less turbulence, it's going to be less likely to collapse in the airway. So especially for people who are prone to obstructive sleep apnea, it's going to help to keep their airway open, but it's just going to be more efficient too. So if you're breathing slow, so here's what I want you to try. According to James Nestor, an ideal breath is 5.5 seconds in, 5.5 seconds out for a rate of 5.5 breaths per minute. But nobody does that. So I'm going to invite you, that's very specific. I'm going to invite you to try 4 seconds in, 4 seconds out. I'll count for you. And if it feels wrong, if 3 is better, 5 is better, whatever, that's okay. But This I love too, a Hoberman sphere. So you're going to inhale. 2, 3, 4. Exhale. 2, 3, 4. Inhale. 2, 3, 4. Exhale. 2, 3, 4. Inhale. 2, 3, 4. Exhale. 2, 3. Now let's try to see if we can exhale for 6. 2, 3, 4. Exhale. 2, 3, 4, 5, 6. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5. One more. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5, 6. Excellent. How did that go? Everybody okay? What was that? Those are long breaths. Yes. And these are all invitations, right? So for you, it might be better to do 3 in, 5 out, or 2 and 4. It's something that you can play with, and go ahead and go to the next one, because this is basically, if we prolong the exhale, the inhale is a sympathetic, and there's nothing wrong with the sympathetic nervous system. We need to have that at some point. You need to run from the tiger if it's chasing you. That's helpful, okay? But if it's not chasing you, you don't want to be going to bed and be in the sympathetic mode. So in order to switch into the rest and digest or parasympathetic mode, one of the ways is by prolonging the exhale, because again, the inhale is sympathetic, whereas exhale is more relaxing and parasympathetic. So if you can prolong the exhale, and another way that you can try it is with humming. So if you inhale and then you hum, and let me tell you, so remember when we were talking about the tongue? So if you put your tongue here and then suction it up, well, don't suction it up, but say the letter N. So if you hum in, you're going to have that tongue in pretty much the correct tongue posture again. And having the tongue up in the roof of your mouth also triggers your vagus nerve and helps you to relax. So we'll try inhale, and then you can hum. Inhale, and try going higher. And then you can even play with it. So you can inhale, and you can go, and you'll feel it kind of vibrate in different places. All right, go on to the next one. Okay, so breathing low also uses your diaphragm. Everybody is using their diaphragm to breathe. There's no way that you can't, but some are better at doing it than others. So if you want to kind of check where it is, you've got your ribs that go all the way around. And if you feel in there, that's exactly where your diaphragm attaches. And it goes all the way around the back. So many people talk about belly breathing versus chest breathing, and that's great. That's a good start. And I like to think of it kind of like a jellyfish. So it's in 3 dimensions. And as you work with me, we learn how to breathe not only in the belly, but also expanding ribs and breathing air into the back, and kind of thinking of a jellyfish as you do it. So I want you first to just place one hand on your chest, one hand on your belly, and just see if you can notice first which hand is moving for you naturally. Is it that top hand that's moving more? Or can you focus and get that air? Give it a color if you want. My favorite color is turquoise. So give it a color as it goes down, and see if you can kind of trace it up and down and allow it to go all the way down. So as you fill up with air, your diaphragm is going to go down just like a balloon. It fills up, and then as you exhale, it's going to relax to come up.
What happens if you feel like restricted with your breathing? Like,
That's a great question. So meaning that you almost feel like your diaphragm, like you can't breathe down?
it's too full or constricted, there's not enough space to get that full deep breath.
Yeah. So you can literally just kind of massage the ribs and move, because that does happen sometimes, especially in females. And when we're young, we're taught kind of to suck in our bellies, right? At a young age. I mean, I was a dancer. And so that was my world. So to be breathing and allowing my belly to expand was totally foreign to me. You can also, let me see. So you can sit in your chair and you can kind of, I might go off screen. Let's see. You can put your hands on your knees and you can sort of rock back and forth and even side to side to start to open up your ribs. And then you can take your hands in like their little cups to get water. You could reach them up to the sky and sort of bring them up like this. And that opens up the chest a little bit. You can even put your hands and clasp them right behind your head. Kind of like warming up to breathe. And then you can just let them go and see if that helps a little. But not to open up, not to open up a whole can of worms, but this is where I learned. For me, I was a little constricted too, and I had no idea there was such a thing as pelvic floor specialist, pelvic floor anything. And so my pelvis was so far back that I wasn't able to coordinate my pelvic floor with my diaphragm, which also limited my breathing. And so when I was able to do exercises in order to train that more, it helped my breathing as well. So
That's just like this fascia here.
Yeah, it was someone in the Wellness Collaborative where I said, who else needs to come to the table? And they said a pelvic floor specialist. And I was like, okay, I think I just met one, but can you explain that to me? So she said that we're connected from the tip of our tongue to the tips of our toes, but that if you have a tongue tie, it can literally go right on through and affect your pelvic floor. And so not everyone has a tongue tie, but if your tongue is a tight attachment or it's just never learned how to go up to the roof of your mouth, especially with kids these days where their mouths are open, they're on devices all the time, then they're just used to having that low tongue posture. Okay, so we're going to review how to breathe functionally. We want to have the tongue up, so tongue up, lips together, breathe through your nose at all times. And you want to breathe lightly, slow, and low. So go ahead and go to the next one. So what are some things that you can do that you can take away from this? So number one is essentially, it's not this simple. You can breathe through your mouth, that's fine. But for the most part, you want to breathe through your nose at all times. And for the most part, that includes exercise. So people often think that they can't breathe through their nose while exercising. And there's different ways to do it. But with training with the oxygen advantage, I tend to breathe through my nose and out of my nose. So a lot of people will, which is okay. But the problem with breathing out is that you're breathing out more carbon dioxide, and carbon dioxide is not a waste gas. It's actually what signals your body to be able to let go of the oxygen that you're carrying around in the blood. It replaces it in the hemoglobin, and then you can actually use the blood, use the oxygen that you're carrying around in the blood and use it for your muscles. So if you're constantly breathing off more carbon dioxide, then you're breathing in plenty of oxygen, but you're not actually getting to use it. So you'll be more sore and you'll fatigue faster. You want to breathe light, slow, and low. You can learn some simple exercises to retrain your breathing. There are lots of books. I do love breath. And there's other ones on my website. But those are two that are fantastic. There's now 2 free apps that you can download. Buteyko Clinic is more of just functional breathing, kind of goes through some of the exercises. Oxygen Advantage will have some more of the breath holds for doing exercise so that you can, it's almost like simulating altitude training so that you can kind of like naturally blood doping. So you create more red blood cells to carry the oxygen. So we all have to breathe every day. So there's plenty of opportunities for you to do these exercises without people noticing. So I always try to attach it to something that I'm doing already. So if that is, my commute, if I'm driving, I may do some of these exercises while I'm driving. Or for me as a dentist, there's a lot of repetitive things that I do, like applying bond or whatever, and they have to happen for a certain amount of seconds. So I will do a breath hold, for example, for a certain amount of time as I'm doing these. You want to check in with your breathing throughout the day. So because it's in the background, because we're doing it all day and we don't have to pay attention to it, it's going to be so much more powerful if you start to notice, and maybe, every time that you need to get a drink, you're like, how am I breathing? Or every hour, maybe you have an alarm that just checks in with you and says, how am I breathing? What does that look like? Have I ever noticed before? Can I slow my breathing for a few minutes? Because that's going to, nobody has 20, 30 minutes, or at least I don't, to set aside just to breathe. And so if you can get it in small intervals throughout the day, that's going to be helpful. Okay, what else do we have? And there's so much more. So for now, though, I want to ask, are there any questions? And as you can see, I have some goodies here, so I can talk with you guys about some stuff if you want. But what questions can I answer first? Yes, I can. Do we have any questions? No.
It's just so backwards of what I was taught in school, right? It's just like, it's hard to get your mind around it. Like, CO2 is bad. You want to like get it out, That's what I was taught. So then I learned myself like.
Yeah. So even when I'm giving anesthetic, I would notice, so people will, right? And it's almost like they're hyperventilating for themselves. And so I will say, take a gentle breath in and a gentle breath out. And, I just try to coach them through with my words of how it would be helpful for it to be more comfortable for them. Or I would notice for myself, a lot of people tell me, I find that I hold my breath. And I would hold my breath sometimes as I was working. And it was almost like by holding my breath, I was trying to take away the pain or discomfort or anything that was happening for the other person, which isn't helpful. That wasn't helping them. But a defense mechanism a lot of times is freeze, And so if you are doing something and, you're at work, something is coming at you, you may just hold your breath and not notice it, but that's a defense mechanism. So if we can catch that and redirect ourselves and know, I'm fine, I'm safe, I actually need to breathe.
I do that all the time.
You hold your breath.
Yeah, I noticed
that. Mm-hmm.
It's terrible. And like, I've had like a trainer before tell me, like, breathe, don't forget to breathe. And I'm like, how do I do that all the time?
Mm-hmm. So if you're holding your breath while you're working out, it can be really helpful to use your breathing while you're working out. And so the Oxygen Advantage is great for that. He's really good at describing how to do that. But even like, for example, if you were doing a squat, and so you would breathe, you would inhale, and then as you exhale, as you come up, so that you coordinate your breathing with your movements, so that you're remembering to breathe and you're getting the oxygen to the muscles that need to work, because that's natural, and sometimes you are going to need to, if you're lifting weights or doing something heavy. I know sometimes people hold their breath, but breathing is a good thing. Keeps you alive.
Pelvic floor, they'll say exhale, right?
And everything up. Mm-hmm.
And that's an interesting thing too. I think that sometimes we, I don't know, a lot of people like we can suck in our pelvic floor when we inhale, right? So then it's like dysfunction there, and not like elongating, and then does that make you know what I'm saying?
Yeah, you should explain that again. Do you want to go ahead?
You're probably better. Or I can't. Go
ahead.
You go.
Well, so my understanding is that, and so correct me if I'm wrong on this understanding, but so you have your diaphragm and then you have like your pelvic floor, and they sort of mimic each other for the most part. And so if they're level and you're not, your back isn't tilted or too far forward, if they're able to function together, then as you inhale, that also, am I correct, that it will go down with it and then it will relax as well. So it's almost like they're working as a team in order to, the coolest part, I think, is that when we're using our diaphragm and we're using our pelvic floor, everything moves. Nothing's meant to be static in our body. And so if we're actually using our diaphragm, the reason that breathing correctly can help with blood pressure, can help with heart health, can help with so many other things, is because it is literally massaging all those organs. Digestion, it can help with that, because if we're using our diaphragm, it helps to close off the sphincter in order to prevent acid reflux. If we're struggling to breathe at night and we're trying to breathe and struggling against it, then we can actually push some of the acid reflux up, and that's what goes hand in hand with sleep disordered breathing. So there's so many cool things that just from breathing can change. Any other questions that we have? I can give you a couple other quick exercises, but has anybody heard of mouth taping? Yeah. Okay. So this is, okay, Patrick McEwen actually made or patented or whatever, I don't know, but myotape is my favorite for beginners. But it goes around your mouth instead of across it. And that's why I love it. So here, I'm going to give you the large. I think this is large. And everyone can have one. Okay, so here. And you guys, absolutely. You can put it on right now and I'll give you another one to take home. Anybody can have more than one, but here if you want to try it. So, and I'll show you. I did an entire like networking thing wearing this. Were you at that one? Oh, okay, I'll go this way. I'll get stuck. So you're just going to peel it off, and then it's kinesiology tape essentially. So it stretches around your mouth and it will just gently remind your lips to stay closed. So you just kind of stretch it like this, and then you put it around here, and then it's just enough to remind the lips to stay closed. But I can totally open. I can drink, I can talk, I can do whatever, and it stays in there. It comes in small, medium, and large, so it comes in kid sizes. I don't recommend it for anyone under 4 that can't take it off themselves, but kids, it's also great during the day. You can wear this during the day, so if you catch yourself with your mouth open, you can use this. There's also no magic to this. You don't have to buy pink, but I think colors are fun, obviously. And so you can get just a kinesiology tape for sensitive skin, and you can do the same thing. So there's 2 ways, because I do think it's terrifying for people to go across their mouth, but I'll show you one way where you can. So this one you can order. That on my website, there's a link for you to order it, or you can So then you can just take a piece of kinesiology tape and you would just cut it into strips. And then you can just do this. This can be enough to remind your mouth to stay closed. And so you can just put one on your chin. And again, you don't have to get hot pink, but you can. And then you can, I can give you more. You can stretch this around and do basically the same thing.
That's cheaper.
It's probably going to be cheaper, but I don't have a specific brand, but I always just look for the one that's for sensitive skin. And so you can make your own. You can try just on the bottom. You can go around just like this. And then, this is $25 for 90 strips. So that's not bad, but this is probably going to end up being cheaper if you want to do it. And then really, really cheap is 3M micropore tape is James Nestor's favorite way to do it. So you just take a tiny piece of tape like this, and it's breathable. You can breathe through it, and you're gonna just fold down each edge so it's super easy to take off. And really all that you need, and you can make it less sticky if you want, and then you just need a little piece that goes like this. And then you can still breathe out of the sides of your mouth, and you can literally still breathe through this. No, do not do that.
Yeah, that's what I always thought. I was like, that would give me anxiety because if I needed to.
No, and so that's why these are my favorite, because it's just so simple. But you can absolutely do the same thing with this. And I've got videos that show you how to do it on my website too. But you can take it horizontally too. You could take a longer piece, and if you want to shape your throat, you can take it like that, and then you can still breathe through it.
And we talk about like head posture.
Yes, good question. Okay, let's talk about head posture. So a lot of times people have forward head posture, and sometimes that's because you are having an airway issue. You're having difficulty breathing. That can be one reason. So the reason for that is because if you tip your chin up a little bit, almost like doing CPR, right? But then you can't see. So then you bring your eyes forward, which makes the head come forward. So a lot of times when we see someone with forward head posture, like, they're having some trouble breathing. But then also throw onto it that if you're constantly like this, your head is very heavy. And so if you're constantly forward like this, you're going to start to hold your jaw differently, and form follows function. So kids will be developing their jaws differently and their heads different, all of that just from habits that we have all the time. Any questions about that? Which brings to form follows function. So this is a myo-munchie. So when we're chewing, we're developing smaller jaws because of the fact that we're just not using our jaws as much as we used to. And so this is a little thing that kids or adults, you can even buy this. You don't have to be a doctor. You can buy it on their website. You can put it in and you can literally just chew. Oh. And especially in kids, this can be a great thing to sort of start to train the muscles how to change the shape of the jaw. It's wild. Yeah. Yep. So just, softer in general. So even if that's pastas, we're just not eating as much meat. But yes, absolutely. Which as a parent, that was very convenient. I didn't know, but the more that you can have a kid chewing, or even adults, depends on who you ask how much you can change. But myofunctional therapy, which is kind of like physical therapy for the tongue and the airway, is absolutely something that I do. It absolutely has been shown to make a difference in people who have sleep apnea and change their risk and the number of times that they're stopping breathing or breathing badly when they're having those events. So, yeah, any other questions? No? Do you want to see a couple more tools?
I did want to add something
Yeah.
when she said about the pouches though and that. I have a friend who's like hardcore carnivore, and she said that the reason she doesn't like that I juice and drink so many smoothies and this and that is because I don't chew. And she's like, and if you're having digestive problems, she's like, you drinking your smoothies aren't helping. And I was like, well, why not? Everything I've read said it helps cleanse your colon and everything because it doesn't have stuff to break down as easy. So I'm like, I'm so torn by that.
So I don't know if maybe you can repeat this, but I've heard too, if you're gonna drink a smoothie, to hold it in your mouth and let the enzymes work. So that helps with digestion. But then, but yeah, so like when you drink a smoothie, you just hold it in your mouth for like 10 seconds before you swallow it. And like who does that? Yes.
So essentially, if you're not chewing and you are drinking and you're having a smoothie, so number one, I think that part of the issue is that you're not giving your body the time, you're not signaling to produce those digestive enzymes and stuff. And so holding it in your mouth for 10 seconds, is that what you said? For like 10 seconds can help with that. And maybe add, like crush some ice in it or something so that you can gives you something to chew. Yeah, or no, this is a funny story actually. I was gonna say get some beef jerky and eat that, but I don't know what your diet is. But I was talking, my kids get so annoyed with me sometimes because I'm like, guys, we need to chew hard things, like beef jerky, and they're like, yeah, mom, you never eat beef jerky. And I was like, I know, but I could, So I come home, right? Yes, I know, I could, right? So I come home and I see beef jerky and I'm like, oh, Daddy was listening to me. He totally got beef jerky. And I grab it and I put a piece in my mouth. And then the kids go, I think that's for the dog. And I was like, what? It says human grade. And I was like, you guys, it says human grade. And the fact that I didn't even notice that. So anyway, I was eating, I ate some dog jerky and I did spit it out because it's really hard to chew, but it didn't taste bad. It was pretty funny.
Like they would actually do the bone, right?
Absolutely.
Bones,
Right, but using those muscles helps to grow the jaw forward, which makes the airway bigger, which is just a lot of cool things because so many of us with the open mouth posture, the faces are getting longer, the jaws are going back, that's where the airway is. And so 80 to 90% of people with obstructive sleep apnea or sleep disordered breathing, which can start with snoring, are undiagnosed. And so if you're snoring, it can be more than just noise. And so for me, I stop breathing 17.5 times if I'm on my back, which is considered moderate sleep apnea. I don't sleep on my back, I sleep on my side. So I'm not considered bad enough to actually have it because there is such thing as positional therapy. And so simply sleeping on my side helps me. But there are other things like obviously there's positive airway pressure, which is often talked about, and I will never talk someone out of it. But there are oral devices. So there are ways that we can keep the jaw from falling back and help to treat obstructive sleep apnea simply from keeping that airway open. There's tons of different designs. There's ones that are printed out of nylon. All of them are custom fit. And all of them need diagnoses for having obstructive sleep apnea in order to use them. But it's pretty cool.
The only way to know if you have that is do that overnight sleep visit where you're hooked up to the monitors.
Yeah, so nowadays there's great home sleep tests. So you don't necessarily have to go into a site to have it done. The polysomnogram is what you're talking about, where you're actually measuring the brain waves. But things have gotten so sophisticated these days that there are rings that can be used. There's little things that go on the finger. There's watch pats. There's all sorts of different ones that you can do in the comfort of your own home. And they're a great start, at least. They can underestimate how many times that you might actually stop breathing because they're not measuring your waves. But for a lot of people, that's good enough. And it's way easier for them and less expensive.
I saw psychologist like 8 months ago, and she had told me that when I was explaining like my anxiety and like, the frequent waking up throughout the night and this and that, and like I'd wake up in a panic, like I was scared every time, and I'm like, I don't know if that's because like I can't breathe or if it's something in my sleep or what. So she was thinking sleep apnea. I was wanting to get tested, but I never did.
Well, it absolutely can be. And so fit females, kids can have obstructive sleep apnea. They're so underdiagnosed. Athletic people, so underdiagnosed. There's a great book called The 8-Hour Sleep Paradox. It's written by another dentist. His kids were making fun of him because he was snoring loudly. And they're like, oh, Dad, we're in the hotel room. Stop that. And so he was getting tested for sleep apnea, but it turned out to be his wife, who was the one that was just waking up early in the morning so that she could work out because that's the way that she would feel good. She was never just fully rested. She was kind of just like waking up enough. And so there's even something called upper airway resistance syndrome where you never really are that typical. Most women don't do that thing where they're like, and stop breathing and then start to, breathe again. You don't see it as much, but they will wake up before they get to that point. So it's called upper airway resistance syndrome. And what happens is that you never get to go into that deep sleep that's really restful. And so it's kind of like eating junk food. It's having junk sleep. So you might be in bed for 8 hours, but you wake up and you're not rested because you didn't actually have.
And that's kind of where I'm at. Because like I'm always yawning throughout the day, I'm always tired, and I'm like, how I've got 8-9 hours, but I'm still waking up throughout the night. I'm going back
What are your thoughts on the Oura Ring? Do you think that's
I think it's fantastic. Yeah, I do think it's a good screener. You can also, I don't know if you snore, but people can use the Snore Lab app. It's free. And if you don't use it every single night, it stays free, but it will give you an objective measure on if you're snoring. And so if you're snoring, there's 2 ways to snore. And so I don't know if you are, but you can snore through your nose, and that would be like, but if you are not breathing as heavily through your nose, you can't make the same sound. So that goes back to that turbulence, right? So retraining the breathing during the day, if you're breathing badly during the day, you're definitely going to be breathing badly at night. So sometimes working on your breathing during the day can help with your breathing at night. The other way you can snore is like this. But if you close your mouth, you can't make that sound. So opening the mouth, which you can't control sometimes, can close off the airway and make the snoring sound. But if you use something like this, sometimes that's enough for people to get restful sleep, to just help to keep that mouth closed. Now you can also do myofunctional therapy and get the muscle stronger and stuff like that. But as long as you can breathe through your nose. So a good test for that is if you put some water in your mouth, and if you can hold the water in your mouth and test that you can hold it there for a minute. If you can breathe through your nose for a minute, you can breathe through your nose for life. So it's usually just a habit in people who are stuffy, it's nasal disuse, and the more you breathe through your nose, the easier it becomes to breathe through your nose.
And my husband, sometimes I'll just be in Canada, and I'm like,
you don't even notice that you're doing it, though, right?
I don't notice it, but then when he calls me out and I try to focus on doing it, then I like panic. So I'm just like, leave me alone when you breathe through my mouth.
Well, for kids, so this might not apply to you, but I usually tell parents, like, if you pet them, it's so annoying when you, well, not annoying, but I think it's hard when you focus on the bad thing, right? Like, stop biting your nails, stop whatever. And so if you can turn it into something fun, and so for them, I'll be like, just tell them monkey cheeks, and they have to take 5 breaths. So you go like this. And then you have to breathe through your nose 5 times. And so that's what usually will help direct kids. Or I say, give them a code word. And so my aunt, she didn't ever want us to say that she had something stuck in her teeth. So she said that our code for her was, my grandma had a piano in the kitchen. And so anytime we would say my grandma had a piano in the kitchen, she would know to go check her teeth because she had something stuck in there. So I have kids make up a code word like pickles or whatever. And when they hear pickles, they know that means they have to close their mouth. But it's not as negative, I guess, as, yeah, it's more playful. Mhm.
So if you think if we're automatically and sympathetic, does
Mhm.
our mouth just automatically go to that, like being chased by a bear? Or is it like,
Yes,
like,
and
is it
so,
more
yes,
force?
that is
Yeah.
a great question. So if you're being chased by a bear or whatever, does your mouth pop open and you start to breathe? Yes. So I did mention that for the most part, you want to be breathing through your nose at all times, even when you're exercising. However, it is totally appropriate that at certain speeds or doing certain things, you're going to need to open up that mouth and be able to breathe, simply because that is a bigger hole and you're going to take in more air that way. So it's not a hard and fast rule, but everyone's point that they get to that is different. Because there are some Olympic runners out there who can breathe with their mouth closed the whole time. Amazing. Anything else? Oh, yeah. I totally forgot about that.
You stop breathing
Yeah.
and then like
Uh-huh.
come all awake. Is there treatments for that?
Absolutely.
Okay.
So that is why I established Sleep Wellness Wilmington, is because it was my passion. I am convinced that my uncle would still be alive if his sleep apnea had been treated. And there are more options than just the CPAP. So I have so many people, and positive airway pressure nowadays isn't even just constant. There's like BiPAP, which means it's different pressures. There's automatic PAP, so it will actually adjust pressures throughout the night. So there are ways that they've made it more comfortable than it used to be, but there's positive airway pressure. There is something called Inspire, which is kind of like a pacemaker for the tongue. It's invasive because it is a surgical procedure to essentially put that in the body, and there's a wire that goes up to the tongue and it stiffens the tongue to get it up and out of the airway. But it's fascinating to me because that's the first research that I did in college. We were trying to figure out a pacemaker for the tongue in the rat model. So the fact that they have that and it works for some people is pretty cool. I didn't have anything to do with it. And there's also myofunctional therapy. So that's like things like tongue clicks. So as simple as suctioning your tongue up there, counting to 3, and then making a loud cluck, like, Ooh, sorry, guys. Good thing no one's around me. Clicking like that. Or you can take your tongue and you can draw a line from right behind your teeth and go all the way back with the tip of your tongue as far as you can. You can try to do that 20 times. It probably does tickle if it hasn't been up there, because that's how our body interprets the sensation. So the more that you do it, the more you'll get used to it, and it gets your body knowing that, oh, that's where my tongue is supposed to be. So just tracing it back. Top. And then tongue circles going between the teeth and the lips 10 times each direction. That one usually gets people, so you can try it. There's so many more than that, but those are the fun, simple ones. And so sometimes people feel that way back here. So myofunctional therapy, and I always can't separate breath retraining from that, because I think you need to breathe. It's not bad. It just shows that you probably have some weakness in your tongue, and that it's very long muscle that does attach. And so the fact that you can feel it back there, you're not failing. You're not failing the test at all. And then there are oral devices. So you can get something made. I make these for people to help treat. And we don't know that it treats until we screen. So there are things that I send home so they can screen and see, did it affect my sleep, and then go back to have a sleep study done to prove that they did treat what we were hoping to treat. So those are all things. And then some people it's their nose, right? So if their nose is causing the obstruction, they can get nasal surgery. And then if they can breathe through their nose, then things won't close off. So many different options. And there's always more. So in addition to Sleep Wellness Wilmington, where there's tons of patient resources, if you're interested in using that as a resource, there's also a link on my website. You can schedule a discovery call with me, 20 minutes complimentary, and videos on there, all sorts of stuff. But also for the wonderful Dr. Mackenzie Jones, I am offering this month-long seminar essentially, and it's also the cool thing is it has a library of the exercises that you can refer to. So once a week you get to meet together, and it happens to be a month where there's 5 Saturdays where we would do breath retraining virtually as a group, and then you would also have the access to chat feature within that and all of the videos and some other hand videos and trainings that are in there as well. So if you're interested, then please, I think I sent you a link, or I can send you one that people can sign up with. Okay. Anything else? Thank you so much. This is fun. Thanks for coming, guys. Hey, do you want this? Please.
Thank you so much. That was awesome. Yes, when I learned all this, my brain was just like, how have I never been told this before? Right? It's like so fascinating. Yeah, when she said, you need to be able to do this and this, and I was like, I can't do that. Found out severely tongue-tied. So I've been down this rabbit hole. But hey, it's worked. It's been cool. So you never know what you'll find. So I say, yeah, I was like, babe, that's right. Yeah, baby steps, right? Like just work on breathing first, I would say. Yeah. Mm-hmm. Yeah, and they miss them. And then I think too, just making sure when we're on our phone, we're being more cognizant of trying to hold our head up and not breathing like that. Yeah, that helped me a lot. But okay, so next month is hormones. So I'm diving into that, and yeah, it'll just be kind of like an overview, and then kind of my approach to treatment. And then I think the next month will be brain health. So trying to give you all the things. Yeah. So thank you all for coming. Yay. All right. Yay. Glad you liked it. Thank you, Casey.